Hi, good afternoon, everyone. Welcome again to one more episode with us at Global Health Asia Pacific. Today, we have Dr. Liyana from KPJ Rawang Specialist Hospital, who is the Occupational Health Doctor there, and she'll be sharing with us today about long COVID. Hi, Dr. Liyana, how are you?
Hi, good
Welcome.
afternoon, Parviter.
Hi, welcome today, and how are you feeling?
I'm okay. How are you guys?
I'm good too.
Yeah.
So let's begin with our webinar today.
Okay, great.
Okay.
Thank you so much, Ms. Parviter, and also thank you so much, Global Health Asia Pacific, for having us from KPJ Rawang. I'm Dr. Liana from KPJ Rawang Specialist Hospital. So I'm the occupational health doctor. So I'm very happy to be able to share a little bit about long COVID and pandemic to endemic. So, so my name is Liyana Khairuddin. So I'm the occupational health doctor in KPJ Rawang. Hope everyone's okay as we transition from our COVID pandemic to endemic. So a little bit about the contents of my talk today. I'll just touch a little bit about COVID, what is long COVID, pandemic to endemic, and a little bit about vaccination. Okay. So, of course, as we all know, after about 2 years going through COVID-19 pandemic, so coronavirus is an infectious disease caused by the SARS-CoV-2 virus. So most people infected with this virus will experience maybe mild to moderate respiratory illnesses, and some will recover without requiring any special treatment. Some, although it can be mild, it can also be quite severe, causing morbidity as well as mortality. So older people and those with underlying medical conditions. So this is, for instance, cardiovascular diseases, diabetes, chronic respiratory diseases, cancers. So these group of people are probably more likely to develop more serious illnesses compared to those without and the younger age group. Okay, so what we need to do is protect yourself and also others. So what we always emphasize is the SOP, social distancing, wear your mask, frequent hand washing, and also get vaccinated. This is something that we've been hearing every day for the last 2 years, basically. Okay, so a little bit about the symptoms. I'm sure everyone knows, but just to run through a little bit. So you can have a range of symptoms. It could be cough, it could be fever, shortness of breath, sore throat. Other symptoms could be loss of taste, loss of smell, chills, runny nose, congestion, body ache. Some also develop gastrointestinal symptoms, which could be your nausea, vomiting, or even diarrhea. Okay, so so it is good that our cases are coming down. Initially, at the beginning of the year, we were peaking very high, few thousands, almost 20,000 cases per day. So, according to the Ministry of Health, so we divide the symptomatic patients into 2A as well as 2B. So anyone with 2A can probably monitor their symptoms at home. So 2A is basically if you have mild symptoms, sore throat, cough, loss of smell, loss of taste, maybe mild diarrhea, nausea, and vomiting. However, if you have a more severe, persistent symptoms or more severe, very fatigued, unable to tolerate orally, persistent vomiting, diarrhea, really bad shortness of breath. So this actually requires you to actually get medical attention at the nearest hospital or clinics. Okay. So going into long COVID. So what is post-COVID conditions or long COVID? So the World Health Organization has defined long COVID or post-COVID as a condition that occurs in individuals with a history of probable or confirmed COVID infection, and it is usually 3 months from the onset of the COVID-19 symptoms. So this can last about 2 months, and generally it cannot be explained by any alternative diagnosis. Okay, so post-acute COVID-19 is extending beyond 3 weeks from the onset of the first symptoms, and the chronic ones is beyond 12 weeks. So this is what we refer to if we want to say it is long COVID or post-acute COVID-19. Okay, a lot of people have quite prolonged symptoms after COVID-19 and simply blame that it's because of COVID. But at the same time, we really need to make sure that it is not anything other than post-COVID or long COVID. Okay, so about long COVID. So how long it takes to recover from COVID-19 is definitely different from everybody. So we cannot generalize saying that, oh, this person recovered immediately, or this person had certain symptoms for a period of time. So everyone has a different duration, so we cannot really generalize. So many people feel better in a few days or weeks. Some will recover by 12 weeks, but there are some small percentage of people who might actually develop symptoms that last longer than this. So the chances of having long-term symptoms does not seem to be linked to how ill you were. So maybe you actually had very mild symptoms during the infection, but realize that you get persistent symptoms afterwards. And people who have had mild symptoms can also have long-term problems, but not necessarily. Yeah. So some people experience a range of new or ongoing symptoms that will last for a few weeks or a few months. So it could be the same symptoms that you had during your infection, or it could be something different or new. Okay. So post-COVID conditions are basically a wide range of new or returning or ongoing. So it could be a persisting symptoms from before, it could be a new symptom or an ongoing health problem that is experienced after being infected with the virus. So there is no specific test to say that you have post-COVID or you have long COVID. So it is basically a diagnosis of exclusion. So that is why it is quite important. If you have any persistent symptoms or really bad symptoms that you are unsure of, you cannot just label it as post-COVID or long COVID without actually getting checked, because it might actually be an underlying other issue. It could be your lungs, it could be your heart, it could be something else. And we cannot simply just brush it off as long COVID. So that's why it's a diagnosis of exclusion. So once you've actually excluded all possible causes, then it probably could be a long COVID or post COVID. Okay. So people more likely to develop long COVID. So it could be people who have experienced more severe COVID-19 illnesses, those who have probably been hospitalized, required ICU care, or ventilated during the COVID infection. Those people who are at higher risk, so those with underlying health conditions, these could be chronic conditions like the heart diseases, hypertension, diabetes, chronic respiratory symptoms. So these people might be at higher risk for long COVID. Those who did not get the COVID-19 vaccine. So as you can very well see, our vaccination status in Malaysia has been quite good. But prior to that, we were seeing very bad and worse cases. So the vaccination actually does help in terms of preventing you from getting really bad complications of COVID. So people who experience multi-system inflammatory syndrome during or after the COVID illness. Okay. So this is a picture of long COVID or post-COVID syndrome. So you can see that the signs and symptoms are a wide range of signs and symptoms. So like I mentioned before, the signs and symptoms can develop during or after COVID infection up to 12 weeks. Yeah. So, and it can even last more than that as well. So you basically need to exclude any other diagnosis to say that it is long COVID. So basically, these symptoms are not explained by any alternative diagnosis. So it can affect any system in your body. So from up, we start with neurological. So you can get cognitive impairments. So a lot of people complain of brain fog, headaches, sleep disturbances. You could actually sleep more or sleep less post COVID. Dizziness, respiratory symptoms are quite common. So people tend to have chronic cough, shortness of breath post COVID. Cardiovascular, if it affects your cardiovascular system, you might have symptoms of chest tightness, chest pain, palpitations. These are symptoms that you need to look out for. Dermatological is skin rashes or a sensitive skin post COVID. You can have joint pains, muscle pains that are actually prolonged. Gastrointestinal, less common but possible. So these are abdominal pain, nausea, diarrhea, anorexia. Ear, nose, and throat is also affected. You can have chronic sore throat, persistence of loss of taste and loss of smell, earaches, tinnitus. You can also be affected psychologically. So some people do develop anxiety as well as depression. So as you can see, these signs and symptoms are quite generalized and can be from any system. So that's why it's important to not simply label it as long COVID, but ensure that you actually get yourself checked. Okay, so this is just in a different language. So it's the same thing. So it can affect all systems in your body. Okay, so the management of long COVID, like I mentioned before, is basically you need to actually get it checked. You can actually get it checked at the government site. You can get it checked at the private clinics, private hospitals. Basically, all you need to do is come and explain your symptoms, come and explain your history of COVID, explain how your COVID infection was during the acute phase, and what are you experiencing post-COVID. So around 10% of patients who have tested positive will remain unwell beyond 3 weeks. So it's about 10%, not a large number, but people do get affected by long COVID. So management of long COVID requires a holistic approach. So it's very important to actually look into the signs and symptoms. There's not one test to actually diagnose or to tell you that you have long COVID, but it needs to be holistically approached to exclude all the possible causes. So, general health. So, what you have to do is you have to take care of yourself. You have to eat well, get adequate rest and sleep. Some people do have like shortness of breath. You can still actually lead a healthy lifestyle. So try to be physically active as well. You don't need to do excessive exercises, but make sure that you are not totally sedentary, totally lying in bed. So limit your alcohol intake, your smoking. If you have pulse oximeters, blood pressure machines, always try to check, especially if you have respiratory symptoms like chronic cough or you have a feeling of shortness of breath. Having a pulse oximetry gives you an idea of your oxygen levels at home, and anything that drops will give you an indication that you require immediate attention. So get good rest. So physical activity. So some people after COVID feel that they are very lethargic. They are easily, they feel easily short of breath. So it's not the same for everyone. So you need to gradually increase it if you want to try, and to ensure that you are safely going into it. Make sure that you are actually well. Okay, so the government has also set up facilities where you can actually get rehab for long COVID. So actually is most of the government hospitals, but this can also be done in some private hospitals as well. Okay, so how do we prevent it? Yeah. So prevention of COVID infection in general. So what we need to do is follow our SOPs, frequent hand washing should not be forgotten. Although cases are in the downward trend, we're seeing maybe about 1,000 plus cases on a daily basis as compared to so many cases prior to this in January, February, March. But we still need to try and maintain our good hygiene to prevent the spread. Masking is still necessary, especially if you are indoors where social distancing is a bit difficult. So it is still advisable to keep on the mask. When you wear a mask, make sure it is a proper mask and make sure it is well fitted to your face. Sometimes you see children wearing adult masks, so it quite defeats the purpose if your mask is too big or if you wear it on your neck. So proper mask wearing is very important as well. Okay. So, what are the precautions that you should take as an individual to protect yourself and your family? So, watch out for symptoms of COVID. So, we know the symptoms are fever, cough, those are the most common symptoms, sore throat. So, if you do have these symptoms, now we have readily available self test kits. So, it's always smart to actually do your self test kits. If you are negative and your symptoms are quite bad, you still should try to remain at home, not to see family members, not to go to work, not to go to school, because sometimes you can actually spread, even though it's not COVID, but nowadays everything is on the rise, influenza and things like that. So symptoms wise, if you do have symptoms, it's advisable to stay home. Okay, so social distancing, although it is right now we do not have that SOP of social distancing, but if at all possible, especially younger kids, those elderly more than 60, those with comorbids, it should also try to be avoid social overcrowded areas. Wear your mask as well as get your COVID booster. So, of course, the primary series 1 and 2, I think most of us have taken that, as well as the first booster. So, those who have not gotten your booster, it is still advisable to get your booster because after the first primary series, your antibodies tends to drop. So, that's why we advise for the booster shot. Okay, so these are the COVID cases in Malaysia. So these are basically numbers for the 8th of June. So active cases 21,000. So on the 8th of June, I think yesterday we had about 1,800. So we're lingering around 1,000 plus cases per day. So this is by age group. So 18 to 59 is always the largest group. We are still seeing small children getting infected as well. Maybe less now, but those who can actually vaccinate your children, you should do so as well. Okay, so pandemic to endemic. So we are looking at a transition from what pandemic to endemic. So what is exactly endemic, epidemic, and pandemic? So endemic is whereby the disease is constantly present in a population and the spread is relatively low. So for example, you have influenza. So it's there. It's always there. There can be times where there is an increased number of infections, but the spread is generally low. Okay, epidemic is sudden increase in cases spreading to a large population, and pandemic where there is a sudden increase in cases across several countries or the whole world, like what we've seen with the COVID-19 pandemic. Okay, so these are the things that we need to do and look out for as we transition from pandemic to endemic. So what we need to do is understand COVID-19 and its symptoms. So of course, many of us have gone through it for the last 2 years. Everyone with fever, cough, sore throat, everyone's like, oh, is it COVID? Is it not? Is it COVID? Is it not? So it's easier now because we've gone through it. There are easily available self-tests that's quite affordable. Some are ranging from 4 to 6 ringgit. Yeah, so once you do understand what are the symptoms, it gives you an idea if you should test, if you should not test. Of course, most of you will know what are the COVID symptoms by now. So it's important to understand the symptoms. All the preventive measures like social distancing, hand washing, wear mask, vaccination, this is always important, even though we have transitioned into endemic. Please continue to do your frequent hand washing. Please continue your masks as well as your vaccination. Those who have yet to take their boosters, please take your boosters. So when you wear a mask, wear it properly, understand the risks and complications. So those are like your post-COVID symptoms or long COVID. TRIS is something called test, report, inform, isolate, as well as seek. So what it means is that you can actually test yourself. So in the beginning, we used to go to the hospitals or clinic, limited places to get tested. But now with our self-test kits, you can easily test yourself. All you have to do is upload the report, whether it's negative or if it's positive, you can upload it on your MySejahtera. Inform those involved. So basically, you inform your close contacts. Although close contacts are not needed to quarantine, but it's just good sense to inform those close to you that you were infected with COVID so they can take the proper precautions. Isolation, if you are positive, you still need to be quarantined and seek medical help when necessary. Yeah. So self-monitoring during isolation. So this is important. So like my previous slide where you have mild symptoms, you can just monitor, you can take some symptomatic medication. But if you do have worse or persistent symptoms, then yes, you require to be treated. Then you have to actually go to a health facility, whether it can be a clinic or hospital, to get yourself checked and treated. Okay, so this is TRIS. So what is test? Test is you can test yourself, report it on MySejahtera, isolate yourself in quarantine if you are positive, inform your close contacts, your family, your work, your school, as well as seek immediate treatment at the healthcare facility. Okay. So when you get tested, so when you are experiencing COVID-like symptoms, so these could be any symptoms. It could be fever, it could be your sore throat, it could be negative, but it would give you a peace of mind that you know you're not having the COVID-19 and spreading it to others. So when you are a close contact, so sometimes when you know that you have been a close contact to someone, and quarantine is not necessary and you don't have symptoms, you might not check it, but knowing the fact that you are a close contact, if you do develop symptoms, you should actually get it checked. You can also get it checked immediately if it's been a few days after the close contact. So when you are attending gatherings, so now it's actually quite a norm for people to test before gatherings. So this is just good sense because sometimes you might not have symptoms or your mild headache or mild sore throat might actually be COVID. So we don't really want to risk our friends, our family, from spreading it. So by doing a test prior to attending all these gatherings, maybe big weddings and parties, we can actually help reduce the transmission of COVID-19 infection. And of course, some schools and workplaces still require COVID testing, so you can actually test accordingly. Okay, so COVID boosters. So pandemic COVID-19. So it's basically, what is COVID booster? It is an additional vaccine given to an individual who has completed the 2-dose series. So a fully vaccinated person would have already taken 2 doses. It could have been Sinovac, it could have been Pfizer or Astra. So individuals who are fully vaccinated are basically protected from COVID-19, especially you are not totally protected by means you will not get COVID. But if you do get COVID, your symptoms might be a lot less and it protects you against complications from the COVID-19. So what it does is that over a period of time, your antibody levels will slowly diminish. So this booster is basically to re-enhance this protection and give you the protection that you need against COVID-19. So with this increased immune response, you have better protection against getting infected with COVID-19. So it's highly recommended. It's not compulsory. but it is still highly recommended. So this is a Lancet study. So as you can see, the blue line is those who have gotten a booster, and the red line is basically those who have gotten 2 doses. So over time, your infection rate for the ones who have gotten 2 doses is more. So basically, or the you can see admissions to the hospital, getting severe COVID, and even COVID-19 related deaths. So with a booster, it actually reduces the admission to the hospital, it reduces severe COVID-19, and it also reduces COVID-19 related deaths. So of course, boosters, there are your Astra, Pfizer, Sinovac. If you've gotten either Astra, Sinovac, or Pfizer, you can get your Pfizer boosters. Generally, if you've gotten Pfizer, you will get your Pfizer as well. Okay. So those the latest is basically your second booster. So this is more to those with who are more than 60 and maybe those who have comorbids. If you have issues getting your booster, you can always visit Protect Health. This is where you can find which clinics or which hospitals are still having their PPVs offering the COVID boosters. You can call and try to see, once you visit protecthealth.com, you will be asked to choose which state you are in, which district you are in, and you can actually look up all the clinics that are available who can actually offer the vaccines. So through this, you can actually make an appointment and they will probably update your MySejahtera from this. Okay, so COVID-19 vaccines in children. So can children take the vaccine? Yes, we've been having pick for children. So this is basically for children 5 years or older until to get the COVID-19 vaccines. So side effects for children might still be the same as the side effects for adults. You can have a little bit of headaches, maybe body aches. The injection site might be a little bit uncomfortable or painful, but generally quite mild symptoms or mild side effects from the COVID vaccine. And generally, it will clear up in about 48 hours. So, should your child take the vaccine? Yes. And why? Basically, because we want to prevent them from getting severely ill and we want to prevent from complications associated with COVID-19. Okay, so this is the side effects. So pain at the injection site is quite common: fatigue, headaches, chills, muscle pain, joint pain, a bit of decreased appetite or nausea. We do advise, if at all you've given your children or even adults, you've taken your vaccination, try to reduce your physical activity for at least a week. You can always report your side effects on MySejahtera. So all you have to do is if you've taken your first, second, or booster shots, you can see that there will be a button to upload your side effects. So this is good so that we can actually collect the data on the side effects from the COVID vaccine. Okay. So everyone needs to do that part. So we should always follow the SOPs, take preventive measures, be aware of symptoms, complications, get help when you need it. If you do have problems or long COVID symptoms, get yourself checked so that we don't want to miss something more severe than long COVID. We don't want to miss, any underlying medical problems that you brush off as COVID-19, long COVID. So it's very important to ensure that whatever symptoms you are having is not COVID, but it could be something else. And if it is long COVID or post COVID, we can actually do a holistic approach of treatment and rehabilitation. So get your vaccine shots because that's important. That is something that we can do together to reduce our complications, to reduce the infections of COVID-19. Okay. Thank you.
Thank you so much, Doctor, for sharing with us the um, things about how to transition into the endemic, and also an eye opening for symptoms where not everything could be related to COVID, or for people who actually need to know about their severe conditions. So let's move towards the Q&A session. So we have one from the audience, from Min Ibrahim. 2 months post COVID, I catch cold or cough rather quickly. What supplements should I take?
So you can take supplements like vitamin C. That's always good. Um, but of course, you need to take care of your health as well. Sometimes you might feel that you are getting sick more often. So always eat well, sleep well, rest well. Make sure you're not getting exposed to sick people. Make sure you're wearing your mask and things like that. But supplements like vitamin C should be helpful.
Okay. Next question. This is something we have collected prior to the event. Um, I tend to forget what I was thinking or wanting to do after COVID. How can I recover?
Okay, so if you from my previous slides, I've mentioned brain fog. So this is something that a lot of people complain about. I have to agree that I myself also go through this brain fog where you easily forget and you are lost in transition. But of course, you need to see the severity of the symptom. So if there are no other symptoms, chronic headaches, blurring of vision, there's no other neurological symptoms, sometimes it actually just takes a week or so. But anything that is persisting for too long, or you feel that the symptoms are actually getting worse, or it's associated with other symptoms or neurological symptoms, of course, this requires medical attention. So this you need to actually get it checked either for further investigations to rule out any other causes.
Okay, like doctor, you mentioned that usually post-COVID symptoms last at least between 2 to 3 months. So let's say, relating back to this question, the person still continues with this brain fog after 3 months. So is it still like another long COVID symptom, or is it associated with something else already?
That's why. So, because the only way to know that it's COVID or not is to get it checked, because you need to do certain tests or scans or to rule out certain things. So we cannot generalize and say, yeah, it's probably post COVID. It's going to go away. What if it's not COVID, and what if it's something else that an underlying condition. So with this, with a persistent or worsening symptom, it's always good sense to actually get it checked. So if you go to a healthcare facility, clinic, hospital, by explaining your symptoms, sometimes they will do further tests. It could be blood tests, it could be scans, but it would be good if you do have persistent symptoms to actually do get it checked.
Okay. Next question. Before COVID, I was perfectly fine. Now I have difficulty in breathing.
So this is also a common complication or side effect or symptom that people complain about. So sometimes it could be because it has caused inflammation in the lungs. You can have like chronic bronchitis. Some people have a secondary infection like pneumonia. So there are a lot of causes of shortness of breath. So it could be that you have a chronic bronchitis or acute bronchitis after the COVID infection. So that's why, especially if you have difficulty in breathing, it's you need to know how severe it is. What is the current issue at that point of time? So if at all you go to a healthcare facility and blood tests are done, chest X-rays are taken, the treating doctor will know what to prescribe. Because some people will not go to the clinic and they just buy off-the-counter medications, but this might not help because you're probably not treating the problem. So that's why it's very important, and I emphasized it quite a number of times to always get it checked. because any, especially difficulty in breathing, that's not a mild or a simple thing. So you need to know what to do and what to take to actually treat that problem.
Okay. Next question. Okay, why do I suffer from severe sinus post-COVID? I have had sinus issues previously, but now it's worse. I get frequent attacks.
So COVID has been said to have caused inflammation, and it can affect all systems. So it can cause hyper inflammation everywhere. So it can cause inflammation, infections in your lungs. It can also aggravate your symptoms of sinus and things like that. So, like I said, sometimes the medications you are taking or off the counter medications might actually not work. So, and it's probably necessary to do further tests to manage it properly.
Okay. Last question. Why is my mucus plastic-like after COVID? This is not normal.
Mm. So from COVID, like I said, it causes like a lot of inflammation. So inflammation causes a lot of mucus production as well. Like the previous person said, the sinus is worse. So this can also be one of the symptoms that you know you get, or persistent inflammation, or sometimes you're not taking proper medications to actually help with this. So you know, if it's actually really bad, if it's like green or is it yellow, you know, sometimes you have a secondary infection. So we need to make sure that it's not a secondary infection that you need to treat. So blood tests and all that can actually show if you require like maybe antibiotics, and maybe it's not just the COVID, but maybe you're having another infection.
Okay. That's all from the audience, doctor. Thank you so much for sharing a lot because I have experienced some of this, actually most of the symptoms when I had COVID.
I agree. I
Um,
agree. I
the
think
brain fog, and yes, I'm a sinus patient too. I have seen my specialist, and my medication has been changing over the time.
did it help?
Yes, now I've come to an end of my second month
Oh,
and
that's
it has started improving. Yes, I don't
good.
get frequent attacks anymore. It's just like maybe in a week once compared to before where I used to get it every day.
Mhm.
But I still do get brain fogs where sometimes I'm doing something and I think of, oh, I need to do it, and within seconds I forget.
Yeah, I think me too.
Yeah.
Guilt.
Yeah, thank you so much for sharing this. And I hope people out there don't take things lightly. Please take care of your health. If you need to seek a doctor's advice, please seek a doctor's advice. Don't self prescribe because sometimes you don't know when you self prescribe, you make things worse.
Correct.
Yeah.
Self-prescribing.
Yeah.
Mhm. Thank you
Thank you
so
so much,
much for
doctor.
being there.
Yeah.
Thank you so much, Global Health Asia Pacific. It was our pleasure. I'm very happy to have been here to share the information. I hope everyone got something from the talk today. Hope that everyone, I mean, there has been so many COVID cases. I think half of us have actually gotten COVID. So any symptoms that you are actually worried about, any symptoms that you might have that you're not sure why it's like that, it's always good to check. Like no harm in checking. It could be nothing, but you know the medications that you're taking might be the wrong medications, and you just need a change in the medications, or some things, very simple things, can actually help. So I hope everyone takes care, get yourself vaccinated if you've not gotten your booster shots.
Okay. Thanks a lot again, doctor. It was a pleasure having you today and hope to see you again soon in the future.
Same, same, same. Thank you
Okay,
so
thank you,
much.
everyone.
Thank you.